joining this Public Health Network Cymru webinar. My name's Emily van der Venter. I'm consultant in public health for Public Health Wales. I'm really glad that you've joined us today to hear a little bit more about the Hapus National Conversation on Mental Wellbeing, a programme recently launched by Public Health Wales, along with some of our national partners who we'll speak about shortly. We know that national surveys show that mental wellbeing has been declining over recent years in Wales, and we particularly see kind of high rates of self-reported anxiety, depression being quite persistent in that post-pandemic period. We know that we've seen over the last decade or so really good improvements in terms of reducing stigma around talking about mental ill health, but we want to help shift the conversation now to talking about what helps to keep us mentally well, building on that change that we've seen in recent years. So we know mental wellbeing is important. It influences our mental health outcomes, our physical health outcomes, and generally our quality of life. Surveys that we've done show that people in Wales do think mental wellbeing is a priority. However, there is lower levels of awareness around what activities, what actions they can take to support positive mental wellbeing, and even lower rates of people reporting they feel able to find the time to support their mental wellbeing. So, as I say, Public Health Wales has partnered with a number of national partners to launch a national conversation on mental wellbeing to try and shift that conversation and improve people's awareness and engagement in behaviours that support mental wellbeing. So this webinar will give you a brief overview of the Hapus programme, the Hapus National Conversation, our approach, our key messages, and some of the ways that you can get involved as individuals or organisations. So Carol Owen is here to present today. Thank you for doing this, Carol. She's a principal public health practitioner in the individual and community mental wellbeing team and is the lead for the Hapus programme. So I will just get some slides up for you. So
thank you.
There we go. Hopefully everyone can see those. And over to you, Carol.
So, as Emily says, I'm one of a team of mental wellbeing and communities. The others are named there. And I'm leading on the development and the implementation of Hapus. So we launched National Conversation very quietly back in July to ease our way into kind of this. These are our objectives. So probably the key ones are we're trying to encourage people to prioritise time to take actions to promote and protect mental wellbeing. We want to engage with communities and organisations, and we really want to try and reduce the inequalities gap that exists across Wales around mental wellbeing and those accessing mental wellbeing promoting activities. Next. So we know that over time, mental wellbeing has been declining in Wales. And it's not getting any better. So you can see from the latest data from the National Survey of Wales that actually it's declined even further from the previous ones, but those worst affected are those living in the most deprived communities. So what is mental wellbeing? Well, mental wellbeing is feeling good and functioning well. There's lots of list of comprehensive definitions, but this is our working definition, and I think it's probably one that most people will understand and relate to. So it's influenced by it's both influenced and influences how we think, feel, and act. So on the right hand of my screen, we also have this quadrant which kind of talks about high mental well-being and low mental well-being and good health and poor health. Obviously, the optimal kind of place you want to be is in good mental and physical health and have good mental well-being. But you can also have a mental or physical health condition and still experience good mental well-being. So that's kind of an important message to take home. And obviously, we don't want to be in poor health and low mental well-being. So the Hapus programme is working at population level to try and promote those activities that can help people be in those places. So again, mental well-being is very much about connection. This is quite an important concept. I think connecting to yourself and accepting yourself is, well, I don't think the evidence tells us that connecting to yourself and accepting who you are is kind of fundamental to good mental well-being. And when you do that, then you can connect to others and connect to the wider world. So that acceptance of who you are not trying to change and please people is a really, really important concept to hold on to. So with that in mind, if you just take a few minutes to think of, not even a few minutes, a little minute, to take just some reflection on what works for your mental well-being. So you can share some in the chat if you want to. You don't have to share, but in saying that, just take a minute. Okay. Happy to move on? So having reflected on what you think helps your mental well-being, I see lots of things coming through. I think you'll probably recognise some of that in some of our ways to mental well-being. These are on our website, which we'll share the link to, and you can go and have a visit. But all of the evidence kind of tells us that all of these things, connecting to nature, you know, having good relationships, being creative, developing hobbies, learning something new, connections to our heritage, our past, looking after our physical health and kind of how we manage our thoughts and feelings is really, really important. So I think hopefully some of your reflections kind of fit into those boxes. So just a few examples of why they're good for mental well-being. So we're going to talk about arts and creativity here. And you can see from the side, I won't go through everything, but like from over the life course, being creative and getting involved in the arts is good for mental well-being. It has benefits for babies and infants insofar as like even listening to music or singing to your baby will kind of promote mental well-being and strengthen bonds between mother and carer. And then for adults, it reduces the risk of depression, anxiety, and yeah, playing a musical instrument or taking part in a dance and yoga can help memory and thinking skills, etc. So all really, really important. And the evidence is just growing around this, which is great. So yeah, we talk about nature as well. So that connection with nature, there are huge benefits, as you can see here. But we talk about, rather than it just being opportunistic moments when you decide to go for a walk and there happens to be trees around you, it's actually using your senses. So using your senses to actually connect with nature. Think about what you're seeing, what you're hearing, whether it's bird song, what smells. And there's loads of ways you can do that in terms of like people might think I haven't got the time to do that, but actually trying to build it into what you are doing. So if you're taking your children for a walk, kind of utilize them to kind of help you use your senses really. And people will find different ways of doing this. I'm not trying to be directive, but I think it's just important that we kind of encourage people to do this. So there are a couple of examples. So I'm going to hand over to Emily because we were very keen and during programme development that we didn't widen inequalities and that we addressed the inequalities that exist. So I'll let Emily talk you through our equality impact assessment.
Thanks, Carol. Obviously, an equality impact assessment is framed around the Equality Act and the protected characteristics that are outlined within that. So whilst this is a general population campaign, as Carol said, we're really conscious of the need to address inequalities and reduce the inequalities in people engaging with wellbeing, promoting activities and in wellbeing outcomes. And obviously not to be really conscious of the fact that a general population campaign does come with a risk that you could increase those inequalities. So we have to put some really focused efforts into ensuring we don't do that, and we of course help to reduce them. So we brought a small team together to initially scope out the equality impact assessment and put some findings against that. We are using it as a live document to continually inform the programme, and we can keep getting additional feedback on it as well. So we've recently shared our equality impact assessment and the associated action plan with Welsh Government's co-production advisory group, so we can get feedback from people representing some of the priority groups and some of those with protected characteristics. We did adapt the list of protected characteristics a little bit based on some of what we know about mental well-being and some of those groups that are at risk of poorer mental well-being. So the Equality Act requires us to consider age, disability, gender reassignment, marriage or civil partnership, pregnancy and maternity, race, religion or belief, and sex and sexual orientation. So you can see we've adapted some. So within disability, we wanted to also have a really explicit focus on neurodiversity and make sure that was considered. And we brought in some additional characteristics to consider around Welsh language, caring responsibilities, income, digital exclusion, and those living in care or communal establishments you can see there. And we did find some particular poorer outcomes in relation to some of those groups and risks that we need to consider mitigating against when we're producing the campaign. So the words in bold in Welsh, sorry, so that's age, disability, race and income were key factors that influence mental wellbeing outcomes and engagement with mental wellbeing activities. So we're considering those alongside the other protected characteristics, both in terms of our approach. So we are primarily a digital campaign at this stage, but we know we need to be careful around that digital exclusion agenda, and we're working to work through others to help us connect in and spark conversations in real life as well. We're also considering these characteristics against the content that we've got within the campaign, the messaging, the signposting within that, and how we work with others. So as I say, building on our national partnership, but also thinking about how we can work with others in local areas to support the campaign to be effective. So the recommendations that came out, I'll talk some more about some of the findings against mental wellbeing outcomes against some of those characteristics in a moment, but key recommendations that came out of our equality impact assessment was absolutely the need to work in partnership with other organisations, really thinking about how we connect in that community wellbeing angle, as well as thinking about individual wellbeing, making sure we've got representation in terms of our messaging, making sure imagery, etc., is inclusive and represents a whole range of different characteristics. The digital angle I've touched on, and then connections, again, kind of building those connections with other organisations that work with people directly within Wales. So, as I say, this is ongoing. We're getting more feedback from the co-production advisory group, and we've developed an action plan to help us address some of the identified potential risks, and that is being overseen by our programme board, who will hold us to account in terms of progress against those actions. So we've had some recent research carried out by Cardiff Centre for Activity and Wellbeing Research, part of Cardiff Metropolitan University, which has been really helpful in further informing our work and building on the EIA. So this has shown, as you can see here, that the types of people who are at risk of poorer wellbeing outcomes, or who had poorer wellbeing outcomes within a nationally represented survey that was completed. So younger age groups, significantly lower, both in terms of individual wellbeing, which this image is reflecting the findings of, but we also looked at social and community wellbeing as well. So those things tend to improve with age. We also found that young people were less aware of what actions to take to protect and improve their mental wellbeing, and they were least likely to report being able to find time to support their wellbeing. Other characteristics, people reporting a disability had significantly lower individual and social wellbeing, and they reported feeling less connected to their communities than those who don't have a disability. And they were most likely to report never or rarely engaging in activities that support positive mental wellbeing. We had interesting findings around people from minority ethnic groups. So they had lower reported individual mental well-being, but they were more likely to report feeling better connected within their communities. They seem to have a better sense of community well-being. And then around income and deprivation, the two most deprived people living within the two most deprived quintiles within Wales had poorer well-being. They also reported having less access to the types of activities that can support good mental well-being. And certainly people in the most deprived quintile reported being less able to connect with nature, opportunities to be physical activity, and feeling less connected to their community. So that's what came through in terms of community connection from the survey, the research also undertook some qualitative work, some focus groups, and it was just interesting to reflect that within those focus groups, people from more deprived communities actually reported feeling quite well connected with their communities. So just helpful finding to take into consideration. In terms of individual well-being, these groups, the characteristics identified on the slide here, actually had more of an influence on mental well-being outcomes than deprivation, living in a more deprived community. So as Carol's early slide showed, we do know that people from in the most deprived communities do experience the worst mental well-being, and this helps us just to think about, well, what's that about, and is it about this kind of clustering of risk factors? Many of these population groups are more likely to be living in more deprived communities, and so it's likely that it's these characteristics that are having that impact rather than just necessarily being in those areas on its own. The survey also found that our free time is obviously important, and only around half of people reported, I think 60% of people reported being satisfied with the amount of free time that they have to engage with activities that support their mental well-being. And again, variation between groups and similar characteristics coming up, as were shown on the previous slide. The final picture there showing that more than 1 in 4 people report saying that actually they don't feel they can find any time for activities that support their mental well-being. And part of what we're trying to do with some of the Hapus messaging is to share that actually some things that you can do for your mental well-being don't take lots of time. So practicing self-compassion and kindness to yourself, noticing things that we're grateful for, those are, and even just as Carol mentioned, having short moments when we actively try to connect with nature and gain the benefits that it has to offer for our mental well-being, can be really powerful and don't take time. Other activities do, but we hope to encourage people to think about the range of things that they can engage with to support their mental well-being. So we will continue to keep our equality impact assessment as a live kind of working document and continue to inform the development of the programme going forwards. As I've mentioned, we have our national partners, and we're now working to build up a cohort of local supporters as well, who can help us to reach those that we most need to. And a fundamental part of the Hapus campaign is really to take an empowerment approach, an approach that encourages and enables people to build confidence, to take action themselves, and to build that community empowerment and involvement as well. So these are the national strategic partners that we have engaged with for the Hapus national conversation, and who are supporting us in the background and helping us to get the message out to communities. But key to our success will be expanding this base of people that are supporting us to get the message out. So I'll hand back over to Carol to talk a little bit more about the Hapus supporter role.
Yeah, so supporters are really, really important to us, because they're kind of either they're organisations, they can be big or small, they have strong links with their communities. We've already got a number of supporters, and hopefully I'm growing, and we aim to keep on kind of helping them to grow, kind of encouraging it to grow. So the supporters' message is to get the message of Hapus and mental well-being out there. Getting people to talk about mental well-being and to prioritise their mental well-being. So we're here as an organisation or as a team to motivate and support you to do that. So we will have social media posts, etc. So seeing if, as a supporter, you kind of can hashtag, I'm not a social media user, so I'm probably using the wrong term, but I do think hashtag is one term I've heard Emily use lots. So hashtag and forward on, just sharing our newsletters, etc. Doing a lot to raise the awareness of the brand and what that brand means and why it's important, etc. We will provide you with brand guidelines and creative assets that you can use alongside your own branding. But we really want to work with you to help and encourage people to promote and protect mental well-being. Sorry, I'm tripping over my words there. Definitely supporters are a vital link between us and our communities. So that said, we would wait for the Welsh one sorry, we would, really welcome if you work for an organisation that isn't already a supporter to kind of have a little think, share what you've heard today, and encourage your organisation to become a supporter. We have an application form. It's online, submitted. There's minimal criteria around, but generally it's not for profit kind of organizations, etc. So it's people who support mental well-being in the broadest sense, and that's what we're asking for. And you will find us. There's our website details. Yes, and it's a really exciting program to work on, and we've got amazing supporters already. And we bring you together as a supporter, we bring people together in webinars and in face-to-face at once a year, where they can support each other and learn from each other. And there's amazing things that organizations are doing out there that I would never know about, but they are doing it, and we just want to encourage them to kind of extend that conversation to mental well-being. So I think that's us. Yeah. Any questions?
Thank you, Carol. That was a really helpful presentation, very slick and informative. And hopefully people have found it inspiring in terms of wanting to look up the Hapus website, have a look at our social media channels, and help us to spread the message either individually or apply to be supporters as supporter organisations as well. So thank you. We're really happy to take any questions if people want to speak. Jamie can unmute people and we can have a conversation, or you can pop any questions in the chat. I'm not sure I did a very good job of keeping an eye on the chat, but if there are any questions, please do feel free to pop a hand up or pop something in the chat. It's really nice to see people sharing some of the things that work for their mental well-being, and increasingly as we do these engagement activities, we do absolutely see people quite naturally coming up with activities and ideas that align to those Hapus themes, which is of course really encouraging to see. We've got physical health as one of our key ways to better mental well-being, and notice somebody in the chat did put comment about getting enough sleep. So absolutely, and that's an area we've got some information on, but looking to build that in the future. So I think as we learn more about what works for mental well-being and mental health more generally, we see that interconnectedness between physical and mental health being really key. So increasing evidence coming out around the importance of our diet for our mental health, for example, that kind of gut-brain link, as well as, I say, sleep and physical activity also being really important.
I think there's a question. Oh yeah.
Yeah, thanks. So Suzanne, thank you. You mentioned the climate crisis also being a mental health crisis, and how are we linking with this? Really good point. Thank you for raising that. And I think we're really aware and keen to promote those co-benefits of connecting with nature for both mental and mental health, individual mental well-being, as well as an opportunity to kind of encourage pro-environmental behaviour as part of supporting our response to climate change. The evidence that Carol spoke about around connecting with nature through our senses has been shown to be really effective in terms of encouraging people to then kind of have more compassion for nature, and actually then be more likely to engage with pro-environmental behaviours. So it does feel like there's a combined activity there that is helpful for both well-being and the environment. And then conversely, obviously, we're thinking about how lots of these activities that we promote can help people to cope with the distress and concern that that the climate crisis can have on mental well-being. A lot of the activities, when you think about engaging with creative activities or hobbies and interests, for example, how they help mental well-being is about getting us into a state of flow, so where we're more relaxed and we're so focused on that activity we're not engaging with other things. And there's interesting research from Swansea University that shows that those types of activities and engaging with a range of kind of flow inducing activities are actually less environmentally impactful as well. So again, a kind of another added benefit in terms of climate behaviours. Sorry, Carol,
Suzanne
did
has
you
her
want to
hand
add?
up. Yeah, Suzanne has her hand up as well, Emily. So I don't know if she wants to come back to you about
Please
that. Then I
do.
might add my own little thoughts.
Suzanne.
Am I on? Yes. Am I there?
Yeah, we can hear
Oh, you
you.
can hear me. Oh, good. That's great. Thank you so much. I'm fully on board with promoting nature connection to support mental health. It's a lot of what we do within our staff wellbeing services as well. But over the years, what I've come to understand a lot more fully is that there's a paradox within this, because the more that people connect with their natural environment and draw on it and really deepen that connection to support their mental health, the more vulnerable we become to experiencing the anxiety and distress. And I think rather than waiting until people do experience that, it almost needs to have a preventative approach, because otherwise it feels like we're leading people into an area where they potentially could experience more distress and despair than they did before. So it kind of becomes self-defeating. So I'm just wondering if that could be part of, I'm not sure exactly how, because it is really tricky, and it is a tension, but in working with staff over time and helping them to explore their nature connection, that has come through really strongly. So it's something that we've been working with and trying to understand, and just wondering what your take on that might be.
Thank you. Yeah, no, I think that's really helpful to flag. And it's that two-sided coin, isn't it? You're more connected with nature, so you're more careful perhaps in your own actions, but then becoming more aware of actually the climate and nature crisis is what I think you're getting at there, and then heightened concern around that. I'm really happy to connect with you afterwards to see how you might be tackling that with some of your staff, and we've got some academics that we can connect with to kind of consider that more. I have to say, so we did, sorry, Carol, I'll bring you in a moment.
Yes, okay.
We had some engagement sessions with conservation workers recently, who are doing some lovely projects across Wales to connect people with nature, and they're working with our Hapus partners. And I was a little bit worried talking to them about well-being and the benefits of nature, but given they are that close to seeing on a daily basis the impact of the climate and nature crises, but was quite reassured. So whilst they did have that level of concern for the environment, I was quite reassured that actually they still, as individuals, found benefit for their well-being in terms of connecting with nature. So yeah, I think you're right, you're absolutely right to flag in is something we can look at further. Yeah.
I think
Carol.
I was going to say something. I was going to talk about that nice project, but I think from a personal level, rather than from any, evidence base, actually, having worked on this program for a number of, since at least post-pandemic, but before pandemic as well, I'm more and more inclined to think about my own mental well-being. And interestingly enough, I have to put my hand up. I wasn't one of those people that was, not that I wasn't bothered by climate change, or obviously I'm bothered, but I didn't really think about it. Wasn't on my agenda. It is more on my agenda now. And I noticed I was on a beach this has happened several times. So I think it's trying to put a positive spin as to, yes, it's awful, but there are things you can do. And on this beach, people were volunteering, picking up plastics that were destroying our oceans, and also having attended, I thought, well, there's a positive things that people can do, and volunteering is good for your mental well-being. And it might only be a tiny thing, but we can all do something. So for me, it's about, I thought I wouldn't mind doing that. Actually, I didn't go over and help or anything like that. But I think I could see myself getting involved in something like that, because I can see the benefits to me and to nature. But also, having gone to as kind of an exhibition that this Nature and Bits project are delivering, I learned so much that I never knew. And it's quite positive. So there's a lot of work going on around Wales, even around, algae blocking out light, so the seagrass and etc. is not able to grow. So people putting effort into and researching a lot more of it. So I suppose what I'm saying is, I think there are positive things we can talk about, as well as recognizing there is a climate change crisis. I don't know that addresses what you've actually asked, Suzanne, but I try and think positively.
Can I just respond very quickly? And I know there's lots of other questions. I think that volunteering is key. So being involved and taking part, like you say, Carol, is absolutely essential. But for people who are less socially inclined, that can be very difficult. And just thinking about some of the groups that you've identified, that is not always an easy thing for them to achieve or to feel comfortable with. But the other process, I guess, apart from volunteering, is climate cafes, that kind of ongoing social support where people can get together in some format to talk through and process the emotions that they feel about what's happening to nature, because that then provides other opportunities for community engagement support. So it kind of ripples out, I know, from what you're focusing on, but these things are all connected.
No, they are,
so
definitely.
I appreciate the conversation. Thank you.
Thank you for the question. That was really helpful. So having a look in the chat, and there's a few reflections from colleagues there. So some saying, yeah, even though working in public health and mental health, we all need those reminders to look after our mental well-being and to take action for it. So support really for it being an ongoing conversation, not just kind of a once-off message that we're putting out there. Quite a few comments around people being interested in the gut-brain link, the relationship between food and our mental well-being, concern around ultra-processed foods, for example, which is where there is some evidence emerging associated with mental health impacts. Questions about housing and planning being a constant discussion. How can the voice of nature and the benefits for mental health assist or be in this space? I think that's really another really helpful one. It's encouraging that we've got upcoming updates to legislation within Wales that will require public sector organisations to undertake health impact assessments on any decisions that they're making, and that will include a requirement to consider mental health and mental well-being, and where that is flagged to be a concern, to undertake a more detailed mental well-being impact assessment. So I think there's one way there. Increasingly, we're trying to engage with public service boards, for example, who have got that link with the Wellbeing of Future Generations Act, and then with the local areas to support this. And I'll just add, other colleagues who are working on obesity, for example, are looking at that real systems approach and what needs to change in our local communities and local environments, including how they're structured, the kind of layout of communities to support good healthy weight, and many of those things are also beneficial for mental well-being. So I think you're right. I think there's kind of a combined case for action to be made there across a number of health outcomes that consider the benefits of nature and engaging with green spaces, etc.
Yeah, I think there's also examples, and one example of good practice I can think of, and that's Thai something as a housing association over in the Gwent area, and when they bought out the social housing, that social housing transfer that took place years and years ago, they were lucky enough to have quite a lot of land, green space around it. So they're really trying to utilise that for community benefits as well as, improving mental well-being. And so I think if we looked for different, examples, we'd probably find a few, but maybe share them.
Yeah, a lot of what we're trying to do with the National Conversations Council is kind of highlight good practice. There's opportunities for sharing by social media, as well as incorporating insight articles and reflections on good practice within some of the posts on our website as well. So that's, again, something that we can consider there. Just still scanning the chat, just going back to the food conversation, somebody flagging that it can be a positive as well. So thinking about baking as an activity that can bring people together and bring positivity and joy to somebody else's day if you're sharing the outputs of your hard work, or even just those really important moments where we come together around a table to enjoy a meal together and have that social connection. Having that as a family time is certainly really important for me and my mental well-being.
There's also an offer of support from, I don't know your name, Avery. Sorry, I don't know your first name. You say you work for Swansea University and work on nature, researcher on nature, and you put your link in there. So potentially, if people are interested, to go to the chat and have a look. I've just spotted that one.
Brilliant. Yeah, thank you for flagging that. The Sustainable Wellbeing Research Group, I think, so we're linked in with Swansea University, the Climate Psychology Group. So it may be that you're part of that or something a bit broader. But yeah, thank you for sharing that resource and encourage people to have a look, and we'll do the same. Thank you. Yeah, and ask if we can share some of the research from Swansea University around flow as well. I'm more than happy to dig out a link to some of the papers and pop it into this meeting chat after the call. So thank you. If there's no more comments or questions, we'll draw it to a close. Just to say, yeah, thank you all for engaging. We'd be really grateful if you could complete a short evaluation form. The link has just been posted in the chat, if you can have a look at that. We'll also send a link around to you after the webinar, and encourage you just to sign up to the Public Health Network Cymru network, so that you can come and be involved and hear about future events as well. So thank you all for your time today. Diolch.
Diolch yn fawr.